I'm back here with Dr. Amir Karam, and we're talking about facial plastic surgery, and he is a facial plastic surgeon specialist at UCI. Before we went to the commercial break, we were talking about a procedure that you have done that's more like a mini facelift that you can go, and you said you can have bike it in and just have it done. You're in and out in the same day. I don't know if you wanted to elaborate more on that. I know you were talking about that before commercial break.
Sure, yeah, I think we addressed most of the issues. Again, it's a well-tolerated procedure. It's pretty popular these days. A lot of patients are interested in having it done. And really, if a patient is a candidate for it, it's one of those things that we have to sit down and discuss and look at the facial types, because again, there's no point in doing a mini facelift or a thread lift in a patient who really needs something a little bit more dramatic in order to achieve their goals. So it's important to make sure that the patient's expectations and the potential for the procedure are in line before embarking on it. Again, there's no opportunity. It's not one of those things that will make facelifting go away completely.
Unfortunately.
So we have to again look at this exact scenarios and the facial types and make a decision together if that's a good option for that patient.
Now, most people that come into your office, what would you say the age range is? I mean, do you have people in their 20s, 30s, 40s, or is it mostly older, would you say?
I think probably for the rhinoplasty patients, oftentimes they're quite a bit younger.
Now, talk about rhinoplasty, because me not being a doctor and I know our viewers are. What is that?
Rhinoplasty is a nose job.
Okay.
And it's one of the operations that we do quite frequently, and it's basically reshaping the nose to make it more pleasing to both the patient and make meet their aesthetic needs. And those patients tend to be a little bit younger. Usually a lot of times they're finishing up high school or early college, and they want to improve their appearance by taking down a hump or changing the angle or the shape of their nose or those kind of things.
And when you have people then in their 30s, because I want to talk about this and ask you some other questions before we close, people in their 30s, what are you mostly seeing with them? What do they want to have done?
The 30s are probably mostly Botox patients and fillers. As they get to the later stages, they begin to late 30s, they begin to see the beginnings of a little bit of a deeper line here, or they may just want to simply augment their some tissue like their lips. But Botox is probably what is seen more commonly in the late 30s and early 40s.
And on fat injections, we were talking about that as well. That is actually taken from your patient, correct? And how long does that actually last? Is that forever?
Yeah,
or?
And it can be forever, and that's an area that we're beginning to develop a lot more at UCI. Dr. Brian Wong, who's one of the professors down there, has a special interest in that. And basically, what that operation allows is the tissue to be removed from the fat, basically be harvested from different parts of the body. For example, the legs, or the stomach, and just like a liposuction, essentially. And it's removed, and then that fat is then transferred and injected into different parts of the face. And the nice thing about that is it's your own tissue, so there's no issues of rejection or decreased risk of infection and inflammation. And that's the nice thing. The downside, the techniques that have been historically used, a lot of the fat that was pulled out, once re-injected, would die off, and you would be back where you started with. Some of the newer techniques in terms of the way we harvest it and handle the fat allows it to live better when we re-implant them. And again, there's some refinements in the technology that have allowed a better yield of the fat that's been re-injected. And in some cases, and in probably 2/3 of the cases, you may need to come back at a different stage later on, 6 months down the road, a year, and re-inject some fat. And some programs have an opportunity where you can store some of the previously harvested fat, so you can go back and re-inject those, or you have to undergo the liposuction procedure again.
Wow. Now, on the fat injections, most people, is it mostly used to fill the lips, or what else on the face? The
real indication nowadays is, it still is used for the lips and the folds and things like that, but the real interest right now is in re-inflating the face. filling the face up the way it used to be when you were 20 or 30.
Yeah.
You know, that
good old days.
the rounded features of youth, basically, and is be able to restore that. Because if your face is deflated and you do a facelift and you pull it, all you're doing is you're pulling that thin skin and thin tissue and making the face look gaunt or windswept, kind of the look of many sort of operated patients, where you can spot them from a mile away.
Yes, you sure can.
So those patients who've lost that facial volume, they may need the facelift to be able to pull things, but in many cases, the facelift is not even indicated in those patients. If you simply fill up that volume again, that the skin will become nice and taut and reestablish a very pleasing appearance of the face.